going to discuss right now is oxygen therapy, but one of the things that we need to keep in mind that's very important is your baseline assessment. Anytime you're seeing a child in your emergency department, in your wards, is the importance of the baseline assessment. So things like their level of consciousness, their vital signs such as their respiratory rate, heart rate, SpO2 or oxygen saturation, blood pressure, those are important baseline vital signs that you will want to gather when you're first assessing your patient. Next, you want to move on to assessing their breath sounds and looking at what their work of breathing looks like, and we'll discuss work of breathing shortly. If they're requiring oxygen therapy, what are their FiO2 that you're going to be applying or what they're on? What type of oxygen therapy are you applying, whether it's nasal prongs, Venti-Masks, non-rebreather, or high-flow oxygen therapy. And you're also going to look at your accessory muscle use. So one of the things through your baseline assessment is, after you take that, is determining whether or not you need to start oxygen therapy. For children, healthy target saturations are greater than 94%. Typically, we would start oxygen therapy for anybody satting less than 94% with their oxygen saturations. And then for a preterm infant, we want to target saturations between 90 and 95%. And your level of respiratory support will then support those SAT targets of 90 to 95%. So another thing that you want to consider as part of your baseline assessment are some of your common symptoms of respiratory distress. So when we talked about earlier work of breathing, we are talking about those signs of respiratory distress, such as retractions, stridor, nasal flaring, tracheal tug, head bobbing. You have paradoxical breathing that will fall under that category, grunting, wheezy, tachypnea, bradypnea, apnea. Basically, your severity of respiratory distress is going to indicate how quickly you need to intervene and how far, as you as the bedside clinician, need to be away from your patient at all times. It's important when you're selecting your oxygen therapy device to make sure that you have an appropriate flow meter for the oxygen therapy that you are initiating. Your standard flow meter is this flow meter here. It's 15 liters per minute is the max flow that it is able to deliver. So those are the standard flow meters that you will see throughout most hospitals and emergency departments and your inpatient wards. In pediatrics, because we are trying to minimize the toxic effects of oxygen, we also even have low flow meters. This one here that I'm holding right now is a 5 liter per minute flow meter. We also have available to us a 3 liter per minute flow meter. And then we have our ultra low flow meters, or our Matheson's flow meters, that can be a little bit more specific level of oxygen that you want to deliver, from 0 to 200 mils of oxygen per minute. So next we're going to talk about nasal prong oxygen therapy. And in front of me here right now I have 3 different sizes of nasal prongs. We have our infant, so again check your label for your sizing. We have a pediatric size nasal prong, and we also have adult. So again, you're going to select your size of nasal prongs based off the size of your patient. So currently here we have our pediatric patient lying in the bed here, which we're going to apply oxygen therapy to him. But before we do that, we want to talk about indications of use for oxygen. And mainly the main indication for oxygen therapy is hypoxia. Your patient appears to be cyanotic, or if you're on the monitor and you have a SAT that is below your well child SAT target. So again, we talked about that being 94% in your pediatric patient, and in your infants between 90 and 95%, okay? So that's gonna dictate what level of oxygen therapy you are going to select for your patient. One of the things when we're talking about nasal prongs to be worried about or concerned about is your child breathing through their mouth? Infants are typically obligate nose breathers, so nasal prongs will work really, really well for them. Children who are a little bit older may be breathing through their mouth, so nasal prongs might not be the appropriate level of therapy, so you may have to consider a different adjunct for that. Again, we talked about patient size selection, and then proper fitting of nasal prongs is really important. So different manufacturers have different sort of features with sizing regarding their nasal prongs. So it's up to you to know what is available to you at your organization in terms of supplies when it comes to nasal prongs. The biggest thing to worry about with nasal prongs is to make sure that they're not completely occluding the nares and that they are fitting and not pressing against the nasal septum, especially if they're going to be used long term, because it can cause pressure injuries or skin breakdown. One of the other things that we need to talk about too when selecting your nasal prongs is your max flow rates for the size of patient and the size of prong that you are using. So in neonates, typically here, we use 1 liter per minute max for our neonates. So that's an infant that is 0 days of age to approximately 1 year of age. We typically go to a max of 2 liters per minute between 1 and 2 years of age. For children over 2 years of age, we typically will use 4 liters a minute max of oxygen therapy. Once we get around 3 liters per minute, that's where we typically will start to consider high flow therapy. And the reason for that is the gas coming out of the wall is dry and could be very irritating to the patient. So when it's heated and conditioned with water, it's much more comfortable therapy for your patient. So do consider that when you're applying your oxygen therapy. So here we have a patient that is currently in hospital and lying in bed, hooked up to our monitor. And as we can see here, our patient is now desaturating and has kept these sats low for a period of time here. And now you want to apply nasal prong therapy to the patient, okay? So we've already assessed the patient for the size of nasal prongs. We've selected the pediatric nasal prongs here. One of the most important things when you have a patient who is in some sort of respiratory distress is proper positioning of your patient. So get them up right as much as you can. You then are going to go to your wall. You're going to attach your nasal prongs to your flow meter. I am now going to take the oxygen end of the prongs and attach it to my oxygen flow meter here at the oxygen nipple. You then are going to turn your flow meter on, and you'll see your graduations are there. So I'm going to start my therapy at 2 liters per minute. The marking should be at the halfway point of the ball. So now we come over to our patient for application of the nasal prongs. So what you want to do when you're looking at your nasal prongs is there's a little bit of a natural curve to the prongs. I'm not sure if you can see that there. But you want to take it and you want to approach your patient with the natural curve to help insert the prongs into the nares. You then are going to take your oxygen nasal prongs, and then you're going to wrap it around your patient's ears, just like so. And then you're just going to snug it up to the patient, just like so, so that it stays on comfortably for the patient. The next thing we want to advise you not to do when you're applying nasal prongs to children is to do this technique here that we see quite frequently. And that's, again, still inserting the nasal prongs, but you're coming in from behind the patient. And again, applying it and then going around the patient's head just like this. Okay, so it's away from the patient. That's the thought, is to do that. The problem is that could potentially slide down on your patient like this and become a choking hazard. Okay, so we don't want to do that. So what we do want to do, again, is just take your prongs, following the natural curvature, insert into the nares, following around the ears, just like so, and then adjusting for comfort. Another thing that you can do is use a piece of Tegaderm to help also additionally secure to the cheeks. So now we're currently on 2 liters per minute, and we would then reassess our patient to see how they respond to the application of oxygen therapy. Again, if this child does not respond immediately, You can increase your flow up to a max of 4 liters per minute and go from there. Here's your patient. We now are at a max of 4 liters per minute and we're still sitting around 90%. So now you want to consider an alternate mode of oxygen therapy. So the best next logical progression for oxygen therapy is your Venti or Venturi mask. It is an aerosol mask with colored collars that will deliver a specific FiO2 based off of your flow ranges. The color will indicate what FiO2 percentage and what liter flow you should set to it. We have both adult and pediatric Venturi masks available to us here. If you only have adult Venturi masks available to you at your organization, that will work perfectly fine for you. Just the mask itself may be a little bit too big for the patient involved at the time. And depending on how low your patient is saturating, in this case here, our child is saturating 91%. Again, we're below that target of keeping it greater than or equal to 92%, but ideally we want to try to maintain oxygen saturations over 94. So we have made the decision that we are going to increase our oxygen therapy to the Venturi mask. So we open our Venturi mask. We have a baggie here of the different collars that will have your specific liter flows and FiO2 percentage. You have a 6-inch piece of corrugated tubing, a pediatric aerosol mask, and 7-foot oxygen tubing. In order to assemble this correctly, take your 6-inch corrugated tubing, attach it to your aerosol mask, just like that. And then based off of your patient's current condition, you are going to select a specific colored collar for the FiO2 that you want to deliver to your patient. So in this case here, because our patient's saturating 91%, and we're already on 4 liters, I'm going to start with pink and 40%. So your collar then will attach to the other end of the tubing. You're going to take your oxygen tubing and attach it to that. Just like that. So that's what your setup is going to look like. And then we're going to go over to our patient and apply it to our patient. So here we are with our patient again, who is now up to 4 liters per minute via nasal prongs, and we're only sitting around 90%. So you want to choose your next level of oxygen therapy. In this case here, we're going to go with the Venti-Mask. And with the Venti-Mask, you're going to have to remove your nasal prongs. But before we do that, we want to talk again why we're considering moving off of the nasal prongs and onto the Venti-Mask. And that is based off our SAT target. So typically, you're going to have a SAT target order to keep SATs greater than or equal to 92%. But if you remember, you should always supplement oxygen therapy when SATs are less than 94%. So again, anytime you're setting less than 94, you want to supplement your patient's oxygen therapy. You want to remove the nasal prongs from your patient. Again, we've chosen the 40%, 8 liter per minute pink colored Venti piece. So we're going to come over to our flow meter. We are going to remove our nasal prongs. We are going to attach our Venti and turn that up to 8 liters per minute. Again, using the ball float as your indicator. Again, the middle of the ball should be right at the liter per minute that you choose. So again, the ball is at 8 liters per minute there. We're now going to apply the mask to the patient just like so. And then using the straps, slide the straps in behind your patient's head, just like that. Okay. Another important thing to keep in mind regarding the Venti-Mask is it is still a dried gas. There is no humidity that we are able to deliver with the Venti piece. The way the Venti actually works is it actually has a little jet orifice where the oxygen actually travels through, and these little holes here, or windows that we call them, actually entrain room air. So by having the oxygen in the medical air at the specific liter flow for the collar that you choose. That's how we're able to deliver the specific FiO2. So that's called the Venturi or air entrainment principle, hence the name Venturi-Masks. So another device that you might have available to you are our large volume nebulizers for oxygen therapy. So we have two different types of large volume nebulizers here. We have, consider this like a low flow or 50% or below device here. And then if you need to use more than 50% FiO2, we recommend using the HeatedHi-Flow or high-ox large volume nebulizer. In addition to having those devices, you're going to need your corrugated tubing here, your sterile water for your nebulizers, and then an appropriately sized aerosol mask. So here we are with our patient now on 50% via the Venti-Mask. As you can see on the screen here, the vitals are quite stable. Child is no longer in respiratory distress. So for long-term therapy, it's probably not ideal to leave them on the Venti piece. So let's have you consider switching to a large volume nebulizer to provide some cool mist humidity to the patient to make the gas more conditioned and more comfortable. So I'm going to go through the setup of the large volume nebulizer. So because we're on the 50% Venti, it's recommended to use the large volume nebulizer here. This one here, even though it's graduated up to 100% FiO2, we find the accuracy is not as good beyond 50%. So we recommend this device be used for 50% or lower for your FiO2 needs. Okay, so I'm just going to remove the lid here. And we have our fill bottle here, and you can see there's a max fill line there for putting sterile or distilled water in. So I'm going to fill this with sterile water or distilled sterile water. Okay. I'm going to screw the lid back on, and then down here on the collar you'll see that there is an arrow and your graduations for your FiO2 settings. So right now that's set to 28%. So what I'm going to do is just dial the collar to get to 50. So we have our large volume nebulizer set up and ready to go here. So I'm going to come over to the wall. I'm going to attach it to my oxygen flow meter. Just be careful not to cross thread as you are putting that on. It's very easy because it's just a plastic collar that screws onto the flow meter. Okay, so I have the outlet facing out towards the patient. I will retrieve my corrugated tubing and I'm going to attach that there. And then I'm going to turn my flow up to approximately 10 or so liters. And again, the one thing that's a downfall to this is it is a bit louder for the patient. So the patient's environment will be a bit noisier. And a good thing to check for, and I'm not sure if you can see that, is the mist coming out of the corrugated tubing there. So that is 50% oxygen with the cool mist humidity. So you can see that there. Perfect. All right, so since the patient already has an aerosol mask on, I can just quickly remove the corrugated tubing from the Venti-Mask and attach the aerosol tubing to the patient. Okay, and then you would go through your reassessment to make sure that your patient is comfortable on this. And also too, given the current vitals where they are, you could probably even consider weaning your FiO2 at this point as well. So what we have here right now are an adult and a pediatric non-rebreather. The non-rebreather is capable of delivering up to 100% oxygen. So these are typically used for your kids who are in moderate to severe respiratory distress, who are unable to keep their SATs within the target range that you're hoping for. Sometimes very quick and easy mode of oxygen therapy until you are able to figure out what's going on with your child and to get them stabilized. So again, with the non-rebreather, some organizations will only stock the adult non-rebreather, and that can be used on any patient. The mask will be a little bit big for that patient, and that's okay as long as you're able to maintain their saturations with that device. But when selecting a device, if you do have a pediatric non-rebreather, that would be the best thing for that patient. So just opening up the package here, most manufacturers have everything that you need already in the package. So what you'll see here is just a aerosol mask with a reservoir bag attached. Okay, so you want to open up the bag just like that. You'll also notice that there is a valve here and a valve there, and then on this side here you'll notice that the valve is removed, and that is for safety purposes. So the thought behind the valves is they will close as the patient, this valve here on the mask will close as the patient breathes in. This valve here will open to allow the patient to breathe 100% oxygen out of the reservoir bag here. Okay, and then you have your your oxygen tubing, and that will attach to the side of your non-rebreather mask, just like so. Here we are back with our patient, and we are now up to 50% and 12 liters per minute with the Venti-Mask, and we're still sitting around 88%. So our next course of action is to choose a device that is able to deliver a higher FiO2 percentage. And that essentially is your non-rebreather mask here. So we have chosen the pediatric non-rebreather mask with the reservoir bag and the valve. So when you take it out of the bag and assemble it, you want to make sure that you inspect your valves. Again, there should only be one valve on the mask. The other side will not have a valve. And then you have your valve that will open from your reservoir bag when you're going to attach it to your patient. And when they breathe in, they will be able to access the 100% oxygen that is accumulated in the reservoir bag. Okay, so we are going to come to our flow meter here and just remove our venti from that. I'm going to attach my non-rebreather, and I'm going to turn that up to 15 liters per minute. And then we want to see our reservoir bag inflate, hopefully. Might have to go a little bit higher. There we go. So you can see that our reservoir bag is now inflated. So we're going to come and remove the Venturi mask and apply our non-rebreather to our patient. Okay. You may see this bag title with their respiratory rate and inspiratory demand. You can see it kind of titling there a little bit as the patient is breathing. You should never ever see the bag collapse. If the bag is collapsing, it means that you're not delivering enough flow for that patient's demands, so you may need to turn your flow meter up or consider an alternative mode of oxygen therapy. So one of the things that you want to consider when using a non-rebreather, especially in our COVID world these days, is especially if you are applying 100% oxygen therapy, the thought is that could potentially be an aerosol generating medical procedure. So we now have filtered non-rebreathers. So this one here is actually an adult filtered non-rebreather, which has filters attached directly to the mask. Here, normally where you would have those valves on your typical non-rebreather. Or we also have another filtered non-rebreather. The filter is actually attached to the inspiratory port of the reservoir bag here. So this is another type of filtered non-rebreather mask that's available on the market. And then are valves that are replaced with filters on this type of device here. Your patient is currently stable on the non-rebreather mask, and you want to begin to start weaning your FiO2, but also you want to consider providing some humidity, because long-term use of the non-rebreather can be quite uncomfortable for the patient. So what I'm going to demonstrate to you is the setup of the HiOx large volume nebulizer here. So what you're going to need is your HiOx nebulizer, a bottle of sterile or distilled water, your aerosol mask, and your corrugated tubing. Now, what we recommend is you can just use the bottle as is. We'll just remove the lid, just like that. Taking your HiOx hose, make sure when you insert it into the bottle, it gets all the way to the bottom. So that way all the water could be drawn up into the nebulizer. Just twist on your HiOx or MNCYN system here, and then that will be ready to go onto the wall. With the HiOx or MNCYN system, your graduations are on there labeled just like the other large volume nebulizer, but you will notice that you can only start at 60% FiO2, turning it up as high as 96% on the collar. So with our patient that we are going to be applying this to, they're on the non-rebreather, so I'm going to leave that at 96% here and demonstrate the setup. So now we're going to attach our HiOx system to the oxygen flow meter. Remember, we've already set that to the highest of 96%. Again, be careful when you're screwing that on not to cross thread as you are. Again, it is just plastic. So get that on there just like that. Now there is a bit more weight to this than the other setup, so just be aware of that. And I'm going to turn that on to 15 liters per minute. Start to see some mist already coming out of the HiOx system there. Going to attach my corrugated tubing. Again, you can do the mist check there. Okay, we see a nice flow of mist coming out of there for the patient. Because we're on the non-rebreather here, we'll have to get a separate aerosol mask. So I'm just going to attach that to the aerosol mask. You can still see mist coming out of the aerosol mask, so that's a good indication. I am going to shut off now my flow meter for the non-rebreather. Come to our patient, remove the non-rebreather, and then apply the aerosol mask for the patient, just like so. Tighten the straps if you have to, just to make it comfortable for them. The other thing to keep in mind is you do want to see mist coming out of the mask as the patient breathes in and out. And that's a good indication that there is enough flow there for the patient. And then just like the previous patient, on the higher FiO2 and the vitals are stable, consider weaning based off your oxygen sat targets. Next, we're going to talk about HeatedHi-FlowNasalCannula therapy. And the typical way of delivering this is using the AIRVO 2 device. And your typical AIRVO 2 device comes set up with a storage basket, your actual AIRVO device here, a IV pole with an attached flow meter, high pressure oxygen tubing, and then your plug for your AIRVO device here. Now with the AIRVO, we have the ability to deliver high flow oxygen therapy to newborn babies all the way up to adults. And we have different consumables based off of the size of the patient that you are applying the therapy to. But with the pediatric population, the AIRVO device has a mode called junior mode. And that's where it is able to deliver oxygen therapy at a heated level of 34 degrees Celsius In the adult mode, it actually goes as high as 37 degrees Celsius. So with the pediatric mode as a safety, they have a little less temperature, but you're able to moisten and condition the gas for it to be more comfortable for your patient. So in the junior mode, you have 3 nasal prongs that are available to you, and you'll see that they are color coded here. We have our medium prongs, which are yellow, your large prongs, which are purple, and your extra large prongs for which are green, in order to deliver therapy to your patient. Now, depending on what size of prongs you pick, depending on the size of your patient, they are only able to deliver a specific liter flow. For example, the yellow nasal prongs can go only to a max of 8 liters per minute. The purple prongs are able to deliver 20 liters per minute, and your green prongs can go as high as 25 liters per minute. In addition to the max liter flows that these junior prongs are able to deliver to, it's important to note that the minimum liter flow that they are able to deliver is 2 liters per minute. If you have a pediatric patient that is a little bit larger and these nasal prongs are no longer appropriate for that patient, we then can move into the adult consumables or nasal prongs. The important key thing to remember here is you have to then switch the AIRVO from junior mode into adult mode in order to meet the flows that these nasal prongs are rated for. So normally 20 liters per minute is a minimum liter flow that you can deliver with the adult prongs, and the high range is up to 60 liters per minute for the adult prongs. So one of the nice things that Fisher & Paykel has done was developed this swing tag that is usually hanging from your AIRVO device. And what it does is actually lists the different size of nasal prongs that are available to you and what nasal prongs could actually be used on the AIRVO versus the OptiFlow setup, okay? So the other important thing as a safety to keep in mind when you're sizing your patients is that your nasal prongs should not occlude more than 50% of the nares. And that's what it's stating here. And that's just a built-in safety that they came up with, because if the prongs are too big and fill the nares up too much, we may inadvertently deliver a level of positive pressure to the lungs. And since we're not able to monitor that, we could be delivering pressures that are too high. So in addition to fitting the prongs appropriately in the nares is a setup guide on the opposite side of the swing tag. And all that does is it takes you through the steps of prepping the prongs for patient application. So here we have our AIRVO device that we brought to the bedside. And as you can see right now, it's not set up for patient application. It basically is a machine that generates flow at high levels. We tee in oxygen therapy through there, as well as we have a humidifier pot that will humidify and condition the gas. So first things first, we'll go through our connection. So obviously we have our power connection. Now, based on your hospital policy, you will want to plug it into the appropriate power receptacle. In our cases here, everything should be plugged into the uninterrupted power supply at our organization. But again, you will follow your hospital policy when it comes to that. Okay, so we've plugged that into the power receptacle. We're going to take our high pressure oxygen tubing and we are going to connect it into the wall at our oxygen wall outlet here. This is a DISS connection, so this will only fit on your oxygen wall outlet. Okay, and you'll hear a little bit of a high pressure flow of gas until that is tightened on there, just like that. With the high pressure hosing, we actually have it attached to a little manifold here with an oxygen flow meter here. This is where you are going to dial your FiO2 percentage in order to deliver specific FiO2 to your patient. Now we're preparing the AIRVO with the consumables to build our patient circuit. So we have our universal high flow circuit here. It has a heated wire circuit in addition to a water chamber that will attach our sterile water for inhalation. So depending on your organization, you may have a 1 or 2 liter bag. This is a 2 liter bag of sterile water for inhalation. And in addition to that, you are going to need oxygen tubing, so your 7-foot oxygen tubing to attach to your flow meter and to your AIRVO device in order to deliver oxygen to your patient. So here's your universal patient circuit for the AIRVO. So I'm just going to open that up. Okay. So here is your humidifier chamber. This is your connection here that will attach your humidifier chamber to the AIRVO device and your heated wire patient circuit, just like so. Remove the covers from the humidifier here. The humidifier chamber there, they just pull out. I'm going to pull this ring off of here. This is going to be our fill line that's going to attach to your sterile water here. We're going to take the attachment device and attach that to your humidifier just like so. We're going to come over to the AIRVO. We are just going to depress this recessed lock here, and we're just going to slide our humidifier chamber into the AIRVO device and connect it to our outlets, just like so. And then you'll hear that click of the device actually locking the humidifier into place. You're then going to grab your fill line and remove it from its coil here. And then just be very careful of the spike here. That is quite sharp when you're going to spike your bag of water. Remove the tab from the water, just like so. And then holding this, just gently insert your spike into the water bag until it punctures through. Try not to puncture through the side there and accidentally poke yourself. And then you're just going to hang your bag of water here, and what you'll notice is you'll start to see water fill into your chamber. And then just take your fill line, and in order to keep things sort of neat and tidy and out of the way, you're just going to push your fill line through this little hook on the device, just like that. When you are going to attach the patient circuit to the device, there is a built-in heated wire that has to be powered by the device in order to keep heat throughout the entire circuit. So you're going to take your patient circuit and you're just going to line it up with the male and female connections on the device. Just push it down and you'll hear it lock. So our next connection is going to be the oxygen tubing from the flow meter to the device. So taking the one end of the oxygen tubing, you're going to attach it to your flow meter. You're going to take the other end of your oxygen tubing and you're going to attach it right back here into the device, just like so. Once we have the oxygen hooked up to our device, we are going to leave the flow meter off for right now. But we are going to power on the device because it does take a little bit of time to heat up. Okay, so you'll hear the beep as we turn it on. You'll see the company name and the device name flash on the screen. And then it's going to tell you when the last disinfection was done, and it uses a stoplight feature to tell you that it's green, it's within the acceptable range. And now you'll see the circling star or sun. That is just telling you the device is now actually warming up. You can actually feel flow coming through the end of the circuit. One thing to keep in mind is the device does default to the last mode, whether it's adult or junior mode that it was last used in. And as you can see right now, it's actually at 60 liters per minute with 21% oxygen, and the temperature is set at 30 degrees. So knowing this device as I do, I know this is actually currently in adult mode. So in order to switch it into junior mode, we want to come to the mode button, or which looks like the play button on the device, and just hold that down for 5 seconds. And now you'll see it chimes and then shows you that it's now in junior mode. The other indication that we're in junior mode is the butterfly and birdie icons on the screen. We are continuing to warm up as we're seeing the circling star sun on the screen here. But also too, you'll notice that on the screen was, with the junior mode switchover, said that there are new target values set in this mode. And you can see right now the new target value is set for 15 liters per minute, with still room air being delivered, and we are now warming up and we are at 29 degrees Celsius. If I wanted to flip between the various settings, actually that chime there just indicated that we now have reached our desirable starting temperature for applying this to the patient. So now what I want to do is, if I want to cycle through the 3 different settings, I just hit the mode button, which I did. All right, we'll do that again here. And we're now currently in the temperature setting. So if I want to adjust the temperature setting, I just hold down the up and down arrow to unlock that. It will then flash when it's unlocked, and now I can adjust my temperature based off of that. However, in the junior mode, we only have one temperature setting available to us, and that is 34 degrees Celsius. If I move on to wanting to adjust my liter flow, I then will have to hold down both arrows to unlock it. You'll see the lock on the screen there. When it's unlocked, the lock disappears, the value flashes, and now I'm able to adjust the flow based on my patient's needs. Now, one thing to keep in mind, in the junior mode, we are only able to go up to 25 liters per minute as our max liter flow. And then our minimum liter flow, as I dial it down here, is 2 liters per minute. You'll also notice it actually tells you the range there. So, okay. Because we're actually not connected to a patient right now, it's actually telling us that there's a leak in the system. It's actually telling you on the screen where to look for potential causes of the leak. Now we are going to pick our patient interface. When you take it out of the package, it actually has sort of like a teeth-like looking connector there. And it's got little indents in there that will actually lock into the patient circuit. Look for those indents, and when you push it in, you'll hear a little snap. Just like that. Because we were alarming because of the leak, because we didn't have the prongs attached, it now sensed that the leak is not as high, and it notified us by that chime that we're now able to deliver the therapy based off the settings that we have set on the AIRVO currently. Here we are back with our patient, and we're still on a non-rebreather. Their SATs have improved, and the patient's much more comfortable. But we don't want to leave the patient on the non-rebreather long term, because the gas is dry and it could be very irritating to the patient. So the next best course of therapy is high flow oxygen therapy. We've already run through the setup of the device. Now we've selected our nasal prongs. So we've selected the extra large nasal prongs for this patient. We're just again going to attach the nasal prongs to our patient circuit. We're going to remove the non-rebreather from the patient. So we are going to come over and just turn off our flow meter, because we will be using the flow meter from the AIRVO for this patient here. We'll remove the non-rebreather. We likely will keep it at the bedside in case we have any clinical indication for it. And then we'll now apply the nasal prongs to the patient. Okay. So first thing you want to do is remove the backing from the colloid material for the wiggle pads. So you're just going to remove the first part of the backing. So we're now going to fit the prongs onto our patient. We have pre-sized our patient ahead of time, ensuring that the prongs are not occluding more than 50% of the nares. The material is quite soft and pliable. Make sure that the prongs, as they're going into the nares, don't crush along the septum or anything like that. So just make sure that they're in there nice and smoothly, just like that, and the patient's comfortable. You're then going to just for the first little part of the wiggle pad that you removed, you're going to hold that down with your hand just like so. You're then going to remove the second part of the backing off of the wiggle pads and just hold that down nicely onto the patient's face, just like so. Just pull that off neatly, just like that. And then I just use your hands to hold them down. A little bit of the warmth will then allow that to adhere better to your patient. The important thing to keep in mind here, in a real patient, the colloid material sticks really, really well. In the simulation environment here, you'll notice that it's not sticking so well. So you might just need to warm it up a little bit more. It's quite possible that will happen in real life with your real patient. Okay, it's sticking well on this side here. So you might just need to sort of use the heat from your hands in order to sort of get the material to adhere better to the patient. And then we'll take our prongs, just like we did with our regular nasal prongs, and you want to try to loop it around your patient's ears and then just adjust it for comfort. And again, with the mannequins, not always cooperative. And then the other thing that we can do, because the circuit is actually quite heavy and bulky, is you can then clip it onto your patient's gown or shirt or bedding, just to hopefully take a little bit of tension off. We now have our patient settled and the nasal prongs are fitted appropriately. We have our clip attaching the patient's circuit to the patient gown. You'll notice that the patient looks up and appears to be quite comfortable, breathing quietly, and your vitals are normal up on the screen here. So when it comes to setting up high flow, there's a couple things to remember. And the biggest thing is the recommended starting liter flows for your patients. So we recommend starting at 1 liter per minute per kilogram to 2 liters per minute per kilogram. I usually start at 1 and then go up from there based off of my patient's level of respiratory distress and how they're responding to the application of high flow there. Do remember that it's really important to know the limitations of your device in terms of liter flow. For example, with little Timmy here, we are currently on 10 liters per minute. 20 liters per minute, and that was 1 liter per kilogram per minute. He is 20 kilos. If I needed to increase my flow as high as 2 liters per kilogram per minute, I would then have to consider switching over to an adult size of nasal prongs in order to achieve the higher flows that this child may require. Keep in mind the green nasal prongs can only go as high as 25 liters per minute. Your AIRVO device will not allow you to go higher than 25 based off of the prongs and the junior mode settings that are currently on there. Okay, so another thing to keep in mind when starting high flow is there is always the potential that you may worsen a patient's distress or worker breathing if you start the flow too high. So the biggest thing to keep in mind is if you feel that your patient's worker breathing and distress has increased upon initiation of high flow, consider decreasing your flow to see if that will make your patient more comfortable. If you're happy with your setup and you are at a point where you want to start weaning your patient as their respiratory rate, their heart rate, and their overall clinical status is improved, the first thing that we would like you to do is wean the FiO2. And weaning the FiO2 should start in increments of 1 to 3% or as high as 5% at a time. And then what you want to do is, again, always go back to your baseline assessment and assess how they're responding to your changes in FiO2. Once you get down to 30%, between 21 and 30% oxygen, then start considering weaning your flow. In your pediatric patients, you can wean your flow by 1 to 2 liters. In your neonatal patients, we recommend going by half a liter to a liter and doing that every 12 to 24 hours in the neonatal population. Within the pediatric population, we recommend weaning that every 4 to 6 hours, okay? The biggest thing is you want to meet your patient's inspiratory demand and maintain their oxygen levels that it's appropriate for your child. So we just finished talking about weaning high flow, but what if you had to escalate your care for high flow? So the biggest thing that we want to have you keep in mind is that if you have to escalate your care, always go up on your flow first. And again, keep in mind the limitations of the appliance or device that is currently being in use. So always go up on your flow to the max liter flow that that device is capable of delivering. And then we want you to increase your FiO2 second in order to maintain your oxygenation. So, okay. These are all based off of the Canadian Pediatric Society recommendations or guidelines for high flow oxygen therapy. You could look these up on the Canadian Pediatric Society website for further information. Okay. If you have a patient who is still not improving on high flow, then you need to start thinking about other alternative modes of therapy. The next logical step would be moving on to non-invasive mechanical ventilation for this type of patient. But also keep in mind that this patient may begin to tire out, that may ultimately need to be intubated and provided mechanical ventilation. So the last thing we need to talk about with high flow therapy is applying high flow therapy to your COVID suspect or COVID positive patient. So ideally you want to do high flow therapy in a negative pressure room if you have that available. If not, use a private room with the door closed is a safe option as well. If you look at some of the recommendations, high flow itself is not necessarily an aerosol generating medical procedure, but it is potentially the patient coughing or the way they're breathing that could be producing aerosols that could potentially be carrying a high viral load. So it's important while you're doing any care with a patient who is COVID positive or suspect that you have the appropriate level of enhanced PPE on for these patients. And the biggest thing is to protect you from that potential viral load of the patient coughing into the room while you're in there providing care. The last thing I wanted to show you guys regarding the high flow oxygen therapy is the fact that if you had to transport your patient to X-ray, to CT, or even up to the patient ward, you can't use the AIRVO device because it doesn't have a battery backup that will allow you to transport your patient on it. But the company has developed its own special oxygen tubing that you can use in order to keep the nasal prongs on your patient. And then basically it's this special connector that you'll see here that then will just attach to your nasal prongs. And then that way for patient comfort, you don't have to fiddle with switching between nasal prongs for patient transport. The only time that you might need to switch off of these nasal prongs is if your patient is going to MRI, because the coils in here that help keep the heat and moisture in the nasal prongs are obviously metal, and metal can't go into the MRI.